As of Tuesday afternoon, the Western Cape has just under 32,300 active cases. All the major hotspots, including the Garden Route and Cape Metro, show a marked decrease in new cases and hospital admissions. Oxygen use is down from 80 tonnes to just under 73 tonnes per day. The West Coast, which peaked after the rest of the province, is expected to show a decline towards the end of the week. The Premier of the province says it's now time to make economic adjustments.
We need to now relax those regulations, so we need to see our beaches opened up, and so that that economy, those jobs can actually start to claw back what they have lost over the last few weeks. Part of our request was to see a change in the curfew. It is now time that we can actually move that curfew back. When it comes to liquor, we've still got to work on flattening the curve, that we don't just open it up, that we also have a restricted liquor sales, but we do open it up. And that in the hospitality industry, this is the on-consumption, that also then be allowed to resume, but of course then run within those curfew frameworks.
The constant vigilance of wearing masks, sanitizing, social distancing and avoiding large crowds remain the best defense against the virus at this stage. However, according to health experts in the province, a vaccine is the most powerful global weapon to turn the tide. Rollout is expected to start in the coming weeks. Provincial authorities are now focused on readiness to implement the vaccine program.
We will continue to wear masks and social distancing and all of those until we have and get to the term that's called herd immunity. And herd immunity means that at least 70 to 80% of all of us should be immune to a virus. That is the whole basis of a vaccination program. As you get to normality, when there is so many people that has immunity to it, that it does not have the ability to cause an outbreak and cause big spread. That is the whole idea. So getting to the absolute herd immunity is the golden chalice. That's what we're aiming for.
There is major concern over the spread of misinformation or fear-mongering over the vaccine. The Provincial Department of Health says South Africa has a long-standing history and programs of vaccinations against diseases.
So it's quite disturbing now when we hear all these sentiments about people discouraging others. So what we are saying is that for those people, they must understand that it is a democratic and a human rights of an individual to have an access to the benefits of the scientific intervention. And also it's not mandatory for anyone to take the vaccine if the person doesn't want to, but allow the other people to be able to make use of the vaccine. It's mostly the people who are very well known and who are very influential, but what is so disturbing, it's about these are the same people who are supposed to provide guidance, to provide the support.
Authorities say the possibility of a third wave is still speculation at this stage. There could be a dip in cases until March, but an upswing in numbers might be seen in April. Mariska Botha, SABC News, Cape Town.